Hello everyone, this is Dr. Rajani, Assistant Professor, Department of Materia Medica. Today we are here to discuss about oxalic acid. Mostly oxalic acid pains actually are important in this and peculiar. It causes pains which are excruciating and that cannot be described. So this is the grand keynote and distinctive. So pains are all worse when the patient thinks of them. This is the most characteristic symptom in oxalic acid. And not only that, also the thinking of pains and conditions will bring them on when they are not actually present. So mostly, suppose the symptom is not there and they think about it, okay, this symptom hasn't been seen and this has not troubled for so long. After that, that symptom appears, that comes up. Next, what you see is voice, altered voice. Uh, Instead of the remarkably deep bass, it is reduced to very low key, like one talking in an undertone. For these people, wine causes headache to them, faintness and vomiting, especially during the stool. But after the stool, the pain would be like during the stool, pain would be there. Once they are done with the stool, the pain would be better, especially the pain would be in back. There is also pain, especially sharp pains through the lower lobe of the left lung, and it matters not what the name of the disease may be. This is also being seen in the pleurisy, right? Maybe pleurisy, pneumonia, thysis, whatever is there, right? This pain, sharp pain through the lower lobe of the left lung, if it is present, oxalic acid cures it. Most often it's been seen that if the sharp pain through the lower lobe of the left lung is present in any kind of disease, be it pleurisy, pneumonia, thysis, any kind of lung disorder, and this pain is present, oxalic acid will do its work. Right? Next, now we are talking about the peculiar sensations. Firstly, the sensation what we see here is jerking pain, like short stitches, especially confined to small spots, and it is only for the few seconds. Next, what you see here is sensation as if all blood had left the brain. So they feel like there is no blood in the brain. There is lightness, lightheadedness mostly, that kind of a sensation. Again, they feel that the blood in the head was coursing upwards and outwards. So mostly they feel that their blood is rushing upwards and also outwards in the head. Mostly in the ear, they feel as if there is a screw behind the ear, each ear, both. Hypogastrium as if bound. In the back, they have a sensation as if it is broken or bruised. In hypogastric region, they have this bound feeling, but in back they have different. That is bruised one and broken feeling. In wrist, when you talk about that, they feel it is a sprained. Hands, if you're talking about, they feel as if it is dead. So these are few symptoms, especially sensations, what we see in oxalic acid other than the pain symptoms. Now, coming to the aggravations, mostly sugar, coffee, wine makes them worse. Next, talking about the mind, the peculiarity, as I have said, is thinking of the complaint that aggravates it or brings it on. So as soon as the patient thinks about the pain, that returns. Thinks about the complaint, that returns. Right? Other than this marked symptom, what we see here is great cheerfulness and clearness of the mind. So very much exhilarated, quicker thought and actions also. Along with the aversion to talk, but that is mostly seen in association with a headache. So whenever there is headache, they do not wish to talk. Otherwise, they are cheerful, they are talkative. So, but during the headache, they do not wish to talk. Next, what we see is the particular symptoms. Starting from the head symptoms, first what you have seen is headache, and it accompanies with the aversion to talk in the patient. Other than that is mostly the headache aggravates or headache is being brought upon by drinking wine. Also, if you're talking about the aggravation, that is lying down after sleeping and on rising, but better after stool. Vertigo is also being seen in oxalic acid, but while looking out of the window, especially when they look outside of the window, they have vertigo. Otherwise, they're fine. And the other time this vertigo is being seen is while rising from a seat. Eyes, if you're talking about the when they're reading, so the typing fonts actually becomes blurred. Small, especially the linear objects appears larger. They are thought to be more distant than they are really, right? So they think even if it is a specs which is kept just nearby, they feel that it is distant. So if it is kept on the 5 centimeters from them, they take it as 7 to 10 centimeters from them. So that appears firstly larger and then distant also, right? So this is how it is. Taste in the mouth would be sour. Pain and accumulation of saliva would be present, especially saliva, but water or mucus accumulations are also being seen in the mouth. There is empty feeling and which compels the person to eat something, with continuous pain in the left hypochondrium, but as I've said, in the hypochondriac region they have bruised kind of feeling. In epigastrium they have violent pain, discharges of flatus which relieves, and along with the intolerance of sugar, wine, they have intolerance of strawberries also, which leads actually to this epigastric pain. There is pain in the upper part and region of navel, mostly 2 hours after eating. This we have seen in anacardium also, with much flatulence. And here what we see in aggravating factor is coffee. So diarrhea is being caused by coffee. Urinary symptoms, now again this urgency would be seen here. Whenever they think of the urination or urinating, it causes necessity to urinate. Frequent and copious urinations, which is clear and straw colored. In male there would be sensation of heaviness and contusion in testicles, which is mostly worst during walk, heaviness of testicles, and it extends into the spermatic cord. But this pain is kind of shooting pain which they have along the spermatic cord. Coming to the respiratory symptoms, they have hoarseness of voice and left lung is mostly painful. Also, they have burning sensation from the throat downwards, constriction of larynx along with the chest also. The tensors of the vocal cord, that is being paralyzed in oxalic acid, which is being seen. So there will be paralysis of tensors of the vocal cord, dyspnea, short jerking inspirations are there. Now the characteristics most marked symptom in oxalic acid is sharp pain through the lower region of the left lung, which extends downwards to epigastrium. Now if this symptom is present, whatever disease it might be or it may be, this remedy works well. Palpitation of the heart, especially after lying down and especially at night. So daytime it's a little better, but comparatively, but at night they have palpitations. Angina pectoris and sharp lancinating pains in left lung coming on suddenly, depriving of breathe. Pain in the back, especially under point of shoulder blade, between the shoulders. Upper limbs, pain first in the left, then later in the right deltoid muscle with inclination to move. Right wrist feels sprained with inclination to stretch it, and stitches in ulnar region, so cannot hold things or anything they cannot hold. Hands are cold as if dead. Heaviness of hands is also seen, so can move fingers but slowly. Restlessness in the legs, violent contracting pain in external tendon of left knee, weariness of lower limbs, they are gone to sleep, paralysis of and stiffness, sensitivity and soreness worse by shaving, marbled and especially in circular patches, it is being seen, perspires easily. These are all of the symptoms of oxalic acid. Next we'll discuss some other remedy in the next class. Thank you.